Hello, I'm Dr. Henri Roca, and on behalf of Argenta Counseling and Wellness, I'd like to welcome you to this introduction to auricular acupuncture. I'd like for you to know a little bit about what it is and what it can do and how we work with it so you can decide whether or not this is something that you're interested in incorporating into your overall care system. Auricular acupuncture using specialized needles. Now, these are specialized needles. These are not ones that stick in and then come out in a few minutes. They're actually designed to continue working, to stay in and continue working. They release on their own when their work is done. So they fall out on their own. You take them home with you as you move through this process. I'll tell you a little bit about myself. Because you're wondering, like, well, maybe why is this dude doing this? Anyway, I'm a conventionally trained family medicine doctor, work with men, women, children, elders, family systems, and have done it in many different places across the country, also in many different settings: urban, rural, suburban, underserved, very well resourced, multiple different kinds of cultural experiences there. I'm also trained as a medical acupuncturist. Now, mind you, that is not a classically trained Chinese medicine acupuncturist. This is a doctor who also uses acupuncture and incorporates it into the overall treatment plan. I was one of the very first people to be trained as a battlefield acupuncture trainer. Auricular acupuncture for pain is called battlefield acupuncture, and the VA sent us to be trained so that we could roll it out across the country. And I helped do that here in Arkansas and nationally. So I've incorporated this kind of approach for both pain, anxiety, and stress in overall integrative and functional medicine programs for veterans. And I am a fellow of the Whole Health Institute. So is this for you? You might think about pursuing this intervention if you experience chronic pain, anxiety, or stress. And if you're working on a program to help identify the drivers. So this is for you if you have an idea about why the stuff is happening, but it's still happening. So if you're interested in a bridge that can help you move farther, faster, this could be perfectly wonderful for you. It is not designed as a single stand-alone intervention. But if you're working on it, this can help you get to where you want to be. So you need to be working with a provider to help you along the journey. And once you're feeling better, this often, 80% or more people feel better with this. Once you're feeling better, this is not the time to go build that treehouse. So you have to really promise to yourself that you're not going to push your limits once you're feeling more space in your life. So those who qualify, those people who this is accessible to, will be people who are clients of Argenta Counseling and Wellness and have a chart within that system and a continuity therapist within the system. So this is an intervention. This is not assessment. This is not a treatment plan. This is a specific intervention. You may be the client or patient of another provider, and I will still do this intervention for you. You may be one of my patients, and I will be able to do this intervention for you. And it's done in a group limited to about 6 people at this time, and sharing is not required, but you will be doing this with other folks. So just be prepared for that. So if you don't know about acupuncture, we're going to very broad brush talk about it a little bit and help us understand what that might be. So acupuncture is a very ancient system. It is perhaps the oldest medical system on the planet, and it's used by the most number of people on the planet because it's used by many Asian people. So it's very ancient and it's observational. People spent a lot of time looking and observing, and what they identified was when you use needles or other tools, and that could be like your thumb, shiatsu, or even magnets or little seeds or even some lasers. There's lots of tools that can do this. You can actually encourage a person's life force to flow with more balance and circulate throughout the body. Now, that is based on this dynamic interchange of forces We think of them as yin and yang and several other forces, and that generates the movement through locations in the body called meridians, or within these microsystems. So the microsystems, again observed over time, are these little miniature maps so that the entire body is represented in a small part of the body. The ear is one of these microsystems. The Chinese and French have observed that. Other microsystems include things like the scalp or the hand. So we can use ear alone to deal with many, if not all, different kinds of symptoms, no matter where they are in the body, because there is this microsystem within which, again, we can encourage energy flow. So we will be placing 4 to 5, sometimes it's 3, but in that order of magnitude, needles in each ear. You can choose to stop whenever you'd like. You can go for all of them if you would like to. And this is the location when we're dealing with the acupuncture approach for pain. So 5 needles in these places, you can see where they are in the ear. You won't be able to see them, but other people will be able to see them. Sometimes it looks like bling, but it is not obtrusive. It's not particularly obvious, but if people are really looking in your ear, they'll certainly see. So people who are really observing your ear will notice it, but otherwise not necessarily so much. And so these treatments are not for you. Do not get acupuncture if you are pregnant or might be pregnant, any kind of acupuncture, including auricular acupuncture. If you have pain, but you don't know why, have no idea why you have pain, please don't use this approach to treat pain. It is effective for any pain, but if you paper over pain that's not diagnosed, you might miss a key signal your body is trying to give you. So if you don't know why you're experiencing the sensations you're experiencing, please get fully evaluated with a full treatment plan. This could be included at that point, but please don't take it upon yourself to try to deal with something that is not understood. If you have a fear of needles, or you faint when you get an injection, or you have a blood draw, you probably don't want to pursue acupuncture of any sort. And if your ears have an infection in there right now, well, we're just not going to needle them. So there's no reason to sign up for the visit that day. If you have a tendency to bleed uncontrollably, when you start bleeding, you just don't stop. It takes a lot. Then probably not the best therapy for you. But it is effective. And we've done studies nationally on thousands and thousands of people with all sorts of drivers of pain, and then also anxiety and stress. But the interval of treatment is about once a week, and that's designed so that the needles fall out and you can have them replaced. Okay? The relief generally lasts for 7 days, but as you continue to receive it, especially if you are doing your program of working through whatever the challenge you have, pain, anxiety, or stress resilience, then it tends to last longer. You tend to build higher and higher plateaus, better and better outcomes. If you only depend upon this therapy, you'll feel good, and then it will go back down to baseline. You'll get it again, you'll feel good. It goes down to baseline. You have to work with it. These are needles, they will stay in your ear. There may be some sensation associated with it, and for some folks, that's just not tolerable. So there can be discomfort. You're going to have to be careful about how you sleep, because if you're one of those side sleepers who digs your head into the pillow, then this may not be very comfortable for you. You might have to really work to sleep with your head facing up and not on the side. You have to play with that. You have to play with that. But that discomfort is something that people can experience. Bleeding or bruising, very rare, but sometimes if the needle falls out when it's not supposed to, like a child hits it or you scratch it because it itches, then you might have some bleeding. Some folks really like this because, man, they feel fantastic. They feel absolutely euphoric. It's like, whoa, they could own the world. So that can happen. Often that diminishes over time, but sometimes that's why people come and get it, because they feel that way. Lightheadedness is usually associated with either that feeling that you might know you had when you fainted, when you got blood drawn. And if you happen to form keloids or those thick scars, you may not want to get this intervention because keloids can form from it. It is very rare to have these needles break. It's theoretically possible, but I've never seen it. Fainting, and sometimes you get a little bit more intense symptoms before they get better, but that also relieves and releases quickly. So aftercare, after you receive the needles, however many you've chosen to receive, remember you're going to take it easy. This is a microsystem that deals with energetic movement through it. So if it's too hot, too cold, if you have sex, if you have a lot of intense exercise, you'll just push right through it. So allow the treatment to settle in. So for the day, avoid those kinds of intense experiences. And for the rest of the day into the next morning, also avoid those kinds of experiences. For the needles, be careful not to hit or scratch or brush them. And I tell you, that's going to happen. You're going to itch your ear. And it's like, oh, there goes a needle. You're going to scrub your ear, forgetting that they're in there. There goes a needle. It can cause irritation, and it might cause them to fall out when you wish they wouldn't have fallen out. You know, we don't replace the needles except at the times we're going to talk about. So most people really pay attention so that this is not a challenge for them. They will fall out on their own. Now, they may fall out quickly, or it may take a longer time. It's a very individual thing, and it depends on how well you maintain them. They will fall out on their own. You can just put them in a small container and just dispose of them. So totally fine. If you need an MRI, can't go into them with these needles, so you'll have to remove them. And when you remove them, you can use a tweezer, you can use your fingernails, and you can just take them out. Now, inflammation can happen. Usually it's just irritation. By that, I mean, that's a little itchy, maybe it's a little red. You know, it might even feel like a little tiny bug bite kind of thing. So you want to not itch because you could just scratch them right out. So that's okay. You can keep them in under those circumstances. But if the area becomes warm, or becomes acutely tender, or becomes swollen, and especially if it has discharge, those needles need to come out. And if there is any kind of drainage or discharge, a provider can possibly be placed on antibiotics. This is rare. Keep your ears clean, but it's rare. Just know that this is how you deal with it if that were to happen. If you're taking medications, continue taking them. Even if you're feeling better, don't just all of a sudden stop on cold turkey. Please work with your prescribing physician to wean off or stop whichever medications. And I wouldn't suggest you do that until your program of self-care is firmly in place. The results can be varying. So they can be a change in your sleep patterns, improved sleep. There can be improved mood. There can be feelings of increased feelings of happiness or satisfaction. Irritability can decrease. All of those things can happen. So take note of those things. It may not show exactly as you expect, but it may still be useful. And then if you're interested, if all of this says, okay, yeah, I'm going to try it. I'll try it and I'll see. It's pretty straightforward to be scheduled. So make sure your provider or your therapist has included a note indicating that they've suggested that you consider auricular acupuncture, that you've had this conversation with them. So make sure they notated it. And then either call or just stop at the front desk and schedule your appointment. So the procedure is done once a week at the same time. Appointments are made once you have paid for the service. These are very high demand appointments. So the auricular acupuncture for chronic pain, that's the one known as battlefield acupuncture. It's scheduled on a Monday afternoon from 4 to 5, and the spots are limited to just 6 people. The auricular acupuncture for anxiety and stress is scheduled on Monday afternoons from 5 to 6. And again, the spots are limited to just 6 people. So feel free to ask any questions, but really just review this presentation. It gives you all of the key points about the needles, about how they behave, about what you can do to keep them in place, about how to be safe with them, and the kinds of effects that you might experience. I look forward to being of service to you. Thank you.